Cooper, you'll find it. Let's do some recap here of what we just did. We were just talking about the lower leg, right? Cool. Okay. So, let's see. Miss Felix Osuna, will you be so kind as to tell us, just to recap here, the 7 muscles, essentially from superficial to deep, that are found in the posterior leg, the sural compartment. And after that, I'm going to ask you what the 5 muscles are that are found in the anterior and lateral compartment, the crural region of the leg. So, but could you tell us about the posterior leg first, please?
Yeah.
Thank you.
So it would be the calf muscles, gastrocnemius, the soleus, plantaris, and then you have the one that locks the knee, which is the popliteus. And then the flexor hallucis longus, flexor digitorum longus, and the tibialis posterior.
Yeah. By the way, I love the way she just did that, everybody. She broke it down like a teacher. She said, first you have the calf muscles, gastrocnemius, soleus, plantaris. Then she said, then you have the key that unlocks the knee, popliteus. And then she told us about the tibialis posterior and the flexor hallucis longus and flexor digitorum longus. Great job. Okay, tell us the 5 muscles in front, kind of from anterior to lateral.
So you have the tibialis anterior, and then the extensor hallucis longus, extensor digitorum longus, and then the fibularis longus and fibularis brevis.
Oh, you're calling her the fibularis longus and brevis. Oh, she's in
Yeah.
that. She's in that
I
camp.
don't think I can speak for peroneals. I don't know. I think it's too hard for me to say it.
Oh, I thought you might like it just because they're on the fibula, so that makes sense to call them the fibularis. Yeah.
No, that's better.
Oh, okay. Fibularis longus and brevis. And the fibularis longus, or the peroneus longus, since they're the same muscle, it likes to meet and have lunch with another muscle underneath your foot. What is that muscle it likes to meet with underneath your foot?
Was it the tibialis anterior?
Yes, ma'am. They create the stirrup of your foot. Later when we talk about fascial lines more, it'll come in handy. That's why I keep making a big deal out of it. And they control foot movement. Like other things control foot movement too, I get it. But these guys, evert and invert and plantar flex and dorsiflex you all day long. That's good. That was really well done. Thank you. Great recap. Cool. Okay. Let me ask what, not of you, Miss Felix, so let me ask somebody. Miss Nguyen. Miss Nguyen?
Yeah.
You think I'm going to ask you to say the muscles, but I'm not, actually. Even though you're prepared, I know you are, and I appreciate that. I just want to ask you a question.
Yeah.
Which side of the foot, which side of the foot, top or bottom, do you find flexors on? Muscles that flex the toes and the digits and the big toe and the little toe. Where would I find flexors on the foot? On the top or on the bottom?
Yeah. You say flex, right?
Flexors, yes. Like which side would I find flexor hallucis brevis, flexor digitorum brevis?
Tibia enter.
But I don't think you understand the question. Where would I find these things? Do I find them on the bottom of the foot or on the top of the foot?
Oh. I think you can find about in the not in the bottom of the foot, but I think.
Let me ask you this. Stop 1 second, Miss Nguyen. Look at me. What type of action are these toes doing right now? When they bend down, what do we call that?
Flexing?
Yes, you're 100% true. We're on track. Where would I have to be to pull these toes under if I was a muscle? Would I have to be on the bottom or would I need to be on the top?
Oh, you can find the muscle on the top.
So I'd be up here pulling them? Are they doing a flexion now?
Oh, that and the bottom.
Right. So flexors are found on the bottom of the foot or the back of the leg. What do we call the bottom of the foot, everybody? What's this region?
Bottom of the
Yep. Miss Petrie just mouthed it. I think Miss Jana's just mouthed it. I think Miss Hanson just mouthed it.
muscle or not?
No, it's a region. It's called the plantar region. This is the plantar region.
Yeah.
Very strangely enough, what do we call the top of the foot, everybody? This is the dorsal region.
Dorsal. No.
Yeah, it's easy to forget that because we're like, that means back. Dorsal region. Cool. All right, thank you. Thank you, Miss Nguyen. Yeah? Miss Stanley. On the foot, Miss Stanley, where would I find flexors?
On the bottom, the
Yeah.
plantar region,
Thank you. And where would I find extensors?
dorsal region,
Thank you. Well done. So we find on the foot, I know there's on the leg too, but on the foot, we find all those brevises, all those flexor brevises on the bottom, the plantar region of the foot. We find all those extensor brevises, basically, on the dorsal region of the foot, the top of the foot. Yes. Cool. Cool. Miss Stanley, since you're doing so well, let me just ask you two more questions, basically. You said I find flexors on the plantar region of the foot, the bottom of the region of the foot, and you are absolutely correct. What area of the leg would I find my flexors on?
what area of the leg?
Mm-hmm.
Flexors, that would be the posterior leg.
Yes. So flexors are found on the bottom and back. Bottom and back. Plantar and posterior. Bottom, back. Plantar, posterior. I love that. Flexors. Where would I find extensors on the leg?
The anterior leg.
Yes. Dorsal anterior flexors. Beautiful. Well done. Thank you very much, ma'am. Really appreciate that clarification. It was well needed. Okay. I think we've done pretty well with legs, and we've touched on feet. We're going to be doing feet a lot next class. So I don't mean next week. I mean when you start your last class of the course, we'll finish up feet and stuff. Let me ask a couple more foot questions really quickly, just to kind of make sure we're all on the same page. Miss Torres.
Yes.
Miss Torres, so let's review a couple things. Where would I find flexors on the foot?
You will flexors on the bottom and the plantar region.
I love the way you said that. Thank you. Where would I find extensors on the foot?
On the top of the dorsiflexion. The
Dorsal region. I got you.
region.
Yeah, well done. No, that was great. What might I find on the edges of the foot?
Abductors.
Yes, thank you. The edges might have abductors that are pulling out. In fact, very likely it's going to be an abductor big toes and abductor little toes. What might you even call that?
Abductor minimi and abductor hallucis.
That was beautifully done. Abductor digitominimi and abductor hallucis. Beautiful. I love that. Okay, if a muscle is going to 3 or 4 toes, what word is probably in it?
Digitorium.
Yes. If a muscle is going to the big toe, what word is probably in it?
Hallucis.
Yes, S. And if a muscle is going to the little toe, what word is probably in it?
Minimi.
Minimi. So thank you, Miss Torres. Miss Torres has just told us where we can find flexors and extensors in the foot. She's told us what we can find on the outside of the foot, abductors. She's told us when we know something's going to the big toe, right? And there are 7 muscles that go just to the big toe that have the word hallucis in them. Then she told us how to tell if stuff's going to a lot of toes, how stuff's going to the little toe. I mean, she probably just gave us a way to kind of vaguely remember 25, 30 muscles. Well done. Thank you very much. Very, very cool. All right. Let's move up the leg. Cool. All right. So, Mr. Kondaris, Can you tell me what muscle group is found in the posterior femoral compartment?
Alright, we got the hamstrings, so
Perfect.
some membranosus, semitendinosus, and biceps femoris.
Couldn't have said it better myself. Can you list those from lateral to medial?
Semitendinosus, biceps femoris, semimembranosus.
It's actually biceps femoris, semimembranosus, semitendinosus. Lots
Oh,
of
you said medial to lateral?
well, either way, you mixed them up, I think, because the semimembranosus and semitendinosus have to be next to each other.
Oh, okay, I was just, okay. In my head I had it like membranosus being medial,
It is.
and isn't tendinosus the most lateral?
No.
Biceps femoris is?
Yes.
Okay, I didn't know that.
No. That's all. I don't think a lot of people do, sir. I'm gonna try to. All right. This is my lame idea of a femur and a tibia and a fibularis. So this is the lateral side of the leg. This is the medial. Meaning there's another leg over here, right? Okay. So one last question, sir. How many heads are in the hamstrings group?
I'm gonna go with 4 because the biceps femoris has 2, and then the other 2 only have 1 each.
Beautifully done. That's exactly what I wanted you to say. Thank you. All right. So because your body, in its wisdom, wants to have your knee pull evenly, it needs to have 2 heads on each side. Yeah? Everybody? So the biceps, the 2-headed muscle on the lateral side come on this side. This marker really stinks. They come on this side, and the semitendinosus and semimembranosus are on this side. So the semis are on the medial side, the biceps femoris on the lateral side, but it gives you 2 heads on each side. And that's how you pull evenly. That's why I'm making such a big deal out of it. That was really well done though, sir. Thank you. All right, cool. Miss Monreal. Miss Monreal, can you tell me the muscles in the posterior femoral compartment? Miss Monreal?
Did you call me?
Yes, I did. You probably couldn't hear me over the chopper blades, but
Okay.
in my mind, you're doing all this really interesting stuff.
I'm not, please.
Okay, well then answer me.
I'm scratching my butt. I'm just kidding.
So am I. That's why I only shoot myself from here on up. What are the muscles of the posterior leg compartment? From lateral to medial.
Okay. So, shoot. Lateral to medial.
Lateral to medial.
I know you were just talking to Mr. Pindaris about this.
Oh, yes, I was.
I have to put it in my head. Why does it have to be lateral to medial?
Well, it could be medial to lateral. Just tell me which way you're going to do it. First.
Okay, let me try the medial to lateral.
Okay, medial to lateral.
Okay, so please be patient with me. I'm picturing.
Oh,
okay, so
Miss Monreal, believe me. I'm extremely patient with you.
the semitendinosus is most medial.
Does medial start with a T?
No. Oh, wait. I quit. Okay.
I've been waiting for this time. Ring that bell.
Okay.
Yeah.
Semimembranosus, then semitendinosus.
Yeah. And by the way, in your defense, it's a little arguable because there's a place where the semitendon is a little bit closer, but if you're going to get really, yes, you go semimembranosus, then semitendinosus. Is the semitendinosus still on the medial side or is it on the lateral side?
Of each other or just in general?
Yeah, I just meant we decided. Are you going with semimembranosus being most medial?
Yes, because that's what you made me think.
Okay, good. So we're going to say semimembranosus is most medial. And are you going with semitendinosus is less than that, more lateral than that?
Medial?
That less medial? What I'm asking is, it stay on the medial side of the leg, or is the semitendinosus now on the lateral side of the leg?
Well, I would have thought that it was on the medial because doesn't it go to the pes anserinus? So
Yes.
I was like, it's on the inside?
Yes, I love that. Good job.
Okay. I mean,
Wow.
it goes to me. Sorry.
It goes to you. Yeah, and those are the two heads on the medial side of the knee. That's why I'm trying to make a big deal of this. Okay, and then what's the last one?
Bicep femoris. I always get mixed up with
Good
bicep
job.
and rectus femoris,
Good
but
job.
bicep femoris.
All right, don't go anywhere, Miss Monreal. I know you're going to get back in the chopper and start cooking dinner and build up a log cabin and stuff, but just wait a second. I got to ask Miss Petrie why she has her hand raised, but I'm coming back to you. Miss Petrie,
Okay.
yes, your hand is raised.
How I remember it is semimembranosus has the M for medial, semimembranosus medial, and then the tendinosus has to be next to the
Remember,
semimembranosus.
semis.
They go side by side,
Yeah,
and so the furthest one has to be the biceps femoris.
that's a good idea. Membranosus and medial. Huh. I'm going to start using that.
Well, isn't she cool?
She is cool.
I'm
Wish
just
I
kidding.
would have thought. Miss Hanson, you have your hand raised.
Do both the semi go to the pans anserinus?
No,
Just the tendons?
just the tendinosus does.
Thank you.
And Miss Petrie, I was just joking.
She's just joking. She doesn't think you're cool.
I had my mic off, so you would have heard me laughing,
Oh,
but
okay.
you couldn't.
Miss Monreal, what is
Yes.
we've now talked about the hamstrings. We've now decided that the semimembranosus and semitendinosus are on the medial leg, thigh, whatever.
Uh-huh.
Both those, actually. And we've decided that the biceps femoris is on the lateral posterior femur and lateral side of the tibia, and fibula. And you were very kind to tell us that the semitendinosus actually inserts in the pes anserinus along with the sartorius and the gracilis. Couple more questions. What is the origin
Oh, gosh.
of these muscles? Not where they insert. I'm not talking about on the tibia and the fibula right now in the
Right.
pes anserinus. I'm talking about where they start.
Well, okay, we have again, I have to work it out in my head.
Yeah.
Okay, we have the ilium, the ischium, the pubis, so it's on the circly part.
Circly part. By the way, she's 100% right, everybody. It is on the circly part. I love that she called it the circular part. I'm going to make fun of her for it, but I love it. It is the circular part.
Think of the name.
What bone is that?
Ischium?
It is the ischium, and that bone is actually very bumpy, everybody, just so you guys know. Hold on. Let me show you something. This is the ischium, this bone here, but you see all these bumps right here?
Mm-hmm.
This is called the ischial tuberosity, and if you want to get really, by the way, I'm fine with ischium, but if you want to get really nitpicky, they insert into the ischial tuberosity.
Okay.
This bumpy, I'm just edifying you with that. But anyway, so yes, they go into the circly thing, the ischium, and that's their origin?
Yes.
Cool. For all three of them?
Wait, oh no, one of them attaches to the femur. Correct? The short head of the bicep femoris.
Oh, wow. Miss Monreal, it took a long drive to get there,
Oh, gosh.
But you got us there. No, you got us there. I like it. I understand why it takes you so long now to answer. Like there's a long process. You hear me calling, you got to circumnavigate, and you finally land the thing, but you landed it. She nailed it, everybody.
Whatever.
So,
You make me feel like throwing up every time you question me. I'm like, what's going on? What's going on?
I have that effect on women, especially. They tell me I make them feel like throwing up. All right, everybody. Here. I'm curving it because it's kind of how a femur works, believe it or not. It kind of goes into your hip here. Hold on. All right. This is your femur up here. And just to be really clear, this is the circly thing she's talking about on the hips. And let's be really, really clear about this. Are you laughing at my picture? Are you, Miss Petrie? I see you laughing. Okay. So, just to be really clear, the biceps femoris, the long head does this, the short head does that. The semimembranosus and semitendinosus do that. So there are 4 heads crossing over the knee, 2 on each side, but the short head of the biceps femoris only goes across the knee. We don't really care because, by the way, the long head's on top of it. But that's just, it's the one hamstring that only flexes the knee. All the other hamstrings flex the knee and extend the hip. Miss Monreal, you raised your hand.
Yes, I love your drawing. It's a little confusing to me. Could you show me on the skeleton? Because because of your drawing, it just seems like they go way over laterally. Are they more centered?
I'm trying not to be insulted by your question, but because I'm such an advanced teacher and because I have very little ego, I'm going to show you on the skeleton. It will not be as good as my drawing, which was almost exactly anatomically correct and perfect in every way.
Close.
It sucked.
For someone with my hips, yes, it looked perfect. That's
All right.
exactly how it is.
All right, yeah, let's check it out, everybody on here. Okay. Because you guys should see this because it tapes off very differently. Okay. Let's do this. All right. Can we? Aha. Here we go. Skeleton. I'm going to turn this down even more so we can really... Okay. Okay. Can we see the skeleton? Good, good, good. All right. So, let's do this. All right. What's this circly thing here called? Miss Bowman? Ischium. This is the ischium.
The ischial tuberosity.
Yeah, this bumpy stuff is the ischial tuberosity. Here is the long head of the biceps femoris. Yeah? Here's the short head. I'm going to do a short head in a different green so we can still see it. Sorry, no nails. Must get up tape. All right. Come on. This is like... Okay.
You work with tape as good as you draw.
Jeez, no. All right. And this is like the short head here that attaches just a little bit up the femur, right? And this is the semimembranosus and semitendinosus. So what is weird, exactly like my picture, by the way, is they really do come way over here. Because the femur actually kind of hangs out here and they kind of come across a little bit. Does that help?
Okay, yes, I do see it. It is kind of like, no, it's exactly like your picture. So even as you take the semi-membranosus and the semi-tendinosus, it does seem like the semi-tendinosus goes, I mean, I know what you're saying is correct. It does seem like it goes most medial because it's reaching over, correct?
Yeah,
But-
what I didn't tape
Okay.
accurately was this. I didn't get nitpicky. It kind of
Okay.
comes from in back and wraps around the bottom of the knee. It's kind of hard to explain.
Okay, could you try real quick? I'm sorry.
That's
I'm sorry.
something I would say. Wow, you are really pushing it today. All right,
I'm sorry.
don't be sorry at all. You're wonderful, and you're right. All right, let's see. Let's see if I can try and redeem myself here. All right. Semitendinosus. The semitendinosus likes to come down here. It likes to kind of come. Oh gosh, hold on. I'm having lots of problems here. It likes to come kind of behind the knee and then over into the pes anserinus. So it's actually coming down and wrapping around on the side. It allows it to really pull really well and put some stuff there. And that's what kind of kicks it less medial than the semimembranosus, which is like here. It snuck in behind and around. It went kind of behind and around.
Okay, that
Yeah.
makes sense.
That's why I meant it's really nitpicky. Like from my point of view, when I'm massaging somebody, I'm never like, oh, this is the semimembranosus. I'm just like, these are the semis. These are the bis. Semis and bis. I just care about the lateral medial side.
Okay, I hope I can help you teach better for the other classes then.
Well, I was hoping you would continue to come to the classes,
Okay.
and I would, call on you, and half an hour
Can
later
you
you'd
start
answer.
saying that when people are on the table? Oh, that is my semi-membranosus right there that I am massaging.
I bet people would tip him.
Oh, Miss Morial, what am I going to do with you? Okay. So, Miss Morial, good. So we've got nailed out let's review, since we talked about a lot of stuff. From
Okay.
lateral to medial,
Okay.
what are the hamstring muscles?
Bicep femoris, short head, and long head.
Good. That's the lateral side. Good.
Okay. Semitendinosus, and then semimembranosus.
Cool. And I don't even care, guys, if you mix those two, as long as you know they're both on the medial side. Good.
Okay.
What are the two actions of most of the heads of the hamstrings?
Extend don't do that. Okay, they extend the knee or the hip? I don't know. Stop.
Maybe they laterally flex the knee.
Wait. Stop. What?
I think you could use a good lateral flexion.
What are you doing to me? I barely got okay with the other thing. Wait.
Miss
Okay,
Morel, how
so
long have you been going to
the
massage
He's
school?
gonna flex the hip, correct?
What's gonna what?
The quads flex the hip.
The quads flex the hip? The
No.
vastus lateralis, vastus medialis, and vastus intermedius flex the hip?
Isn't it, stop, please.
Miss Morel, I'm gonna need
I'm
you to
sorry.
stay after class for like 12 hours today.
No,
We got some
no,
work to
like
do.
the-
No.
The rectus femoris, does that not help flex the hip because it connects to the thing?
Oh, the rectus
the-
femoris does. It connects to the thing.
Okay, well,
Some
sorry,
people
I
call
put
that
them all
the
together, but I'm
anterior
just trying to
inferior
figure out the
iliac
action.
spine. Okay.
So that flexes the hip, so don't hamstrings do the opposite then? Or is that just the glutes?
I think they would do the opposite. That's not what you were saying before, but I would think that would be true.
Okay, do they extend the knee also though? Or no, nothing with the knee?
I think you should go back with lateral flexion. I really like lateral flexion answer.
Lateral flexion.
I saw it once in a
still
karate
don't get
movie.
it.
Yeah. Well, Miss Petrie gets it, so that's...
I'm still, okay, it's alright, go ahead.
So anyway, Miss Monreal, answer one question first. It sounds like you know that it moves the hip and the knee, right?
Okay,
So let's figure out one of those. Because you kind of like get half with one and then you jump to the other one. That's what was throwing me off.
Okay.
So you were making a very astute observation.
Yes.
And that was so much fun. You're making a very astute observation, Miss Monreal, that the rectus femoris does a flexion of the hip. So you were about to say the hamstrings probably do a what?
Extension of the hip.
Yes, they do. That is correct. Good. And what do they do for the knee?
Okay. I always get mixed up with the knee, but that's they flex the knee then, right?
Yes.
Because it's the opposite of what
Yes.
I think. I would. Okay. Yes.
All right.
Okay.
Okay. Which heads create an extension of the hip?
Which heads create an extension of the knee?
Of the hip.
Of what?
None of the heads create an extension of the knee. I know you really want to extend the knee with this hamstring thing, but that's a quad activity.
Okay, well, I guess maybe I didn't listen to your question all the way. Which heads extend what?
The hip.
The hip. Oh, okay. All of them except for the short head. I mean, the short head of the bicep femoris.
Excellent. Really good job, by the way. Which
Oh gosh.
which heads, we're almost done. Which heads flex the knee?
Which heads flex the knee? All of them.
Yeah.
Oh gosh.
You did it. You did it. I've really enjoyed these 47 minutes that we spent together discussing
I'm taking the rest of the week off.
these three muscles. Yeah. Okay. No, good job. Actually, I hope you know I'm teasing you. I have so much fun with you. And it's just it's fun. You're very good at anatomy, actually. I love the fact that you don't memorize it, you think through the process. And you know what? 50% of the time you're right too, and that's good too. So really good job though. 3 hamstrings. Thank you, ma'am. I'm gonna let you go for a little bit. Is that okay?
Yes, thank you.
Thank you. Thank you, thank you, thank you. Okay. All right. Woo! What a wild ride that was, huh? Miss Stanley, what are the 3 hamstring muscles?
The semitendinosus, the bicep femoris, and semimembranosus.
Yeah, that's correct. I don't particularly like the way you listed them, but which one is which 2 are on the medial side?
Semimembranosus and semitendinosus.
Good. Which 2 heads are on the lateral side?
Bicep femoris.
Yep.
And semitendinosus.
What?
Well, I thought it was in the middle, so I thought you meant like the crap, my pencil just broke. What the?
All right. Hang on there, young lady. Come here. You have 4 hamstring heads, right?
Yes.
Biceps femoris. These 2 go together, and the semis go together. Semimembranosus,
Yeah.
semitendinosus. These are on the medial side. These are on the lateral side. Legs in the middle.
See, that's what I was getting at first. We stayed quiet, so I thought you were looking for more. So I said semitendinosus because it was closer to membranosus.
I just wanted to hear you say biceps femoris, long head, and short head, because they're on the lateral side.
Well, it was implied because it's what it is.
Oh, yeah. Don't you argue with me.
I know I do.
What are the actions of the hamstring muscles?
It flexes the knee.
Flexes the knee. Or do they have any other actions? Do they have any other actions?
It extends the hip.
Extends the hip. Thank you. Which heads extend the hip?
Ooh. Wait. So, I feel like I have I have it mixed up, but is one of them the bicep femoris short head?
In
Don't
order,
do the quiet thing. Stop it.
in order, in order to flex something or extend it or abduct it or adduct it, you've got to cross the joint. So the real question is, what stuff crosses over the hip joint and has an origin on the ischial tuberosity? Does the
So
short
it is bicep femoris.
what?
It is biceps femoris then.
Yeah, all right. Both heads?
Yeah.
Both heads extend the hip?
Well, now I feel like saying no.
I would, because there's some people out there going like this, and I would agree with them. Let's look at
I
this.
have you like blown up so I can't see their heads.
All right, well, look at me for a second. Keep me blown up because I want to show you something. Because it'll make perfect sense to you once I show you. Super simple femur. Super simple tibia. Okay? Since I'm getting a lot of crap for them anyway. All right. The long head, watch this up here. There's a hip up here, right? There's a hip up here with stuff coming off it. The long head is long because it has a long way to go. It comes from all the way up from the hip down here. The short head does not have a long way to go. It's why it's called the short head. It is only down here, right? Long head here of the biceps femoris. So, do both heads extend the hip?
Evidently not.
Cool. It's fine you got it wrong. It's great that you understand why. Awesome. Which head of the biceps femoris extends the hip?
The long head.
Yeah! Yeah, cool. And by the way, the semimembranosus and semitendinosus on the other side, because they both go all the way up here too. They go come up here too. Cool.
So then 3 of them extend the hip?
Yes! 3 of them
Maybe
extend.
you asked me which one.
Yeah, maybe. Yeah, I don't know. You're advanced now. I gotta ask you tough questions. Yeah. Okay. And which ones flex the knee?
Well, obviously the short head of the bicep femoris does it, but all of them do.
All of them do. Perfect. Thank you, ma'am. You have redeemed yourself completely. That was really good. Really good. Miss Hanson, you've had your hand raised for quite a while. I apologize. I've been on all these little rolls. Question, comment?
Yes, my son came in when we were talking about the insertion of the hamstrings.
Mm-hmm.
So, do they insert into the tuberosity, the tibia tuberosity?
Yeah, so, no, they do not insert the tibial tuberosity.
Okay, where do they insert into?
Okay, I'm going to give it to you in a simple way, not because you're not smart, but because I think this will help you the most. Let me just kind of show you on a leg here, okay? So, this is the front. This is the front of a femur and a tibia. The tibial tuberosity is the bump below your knee on your tibia, and your quads like to grab it so that they can do extensions. So, not your hamstrings. Your hamstrings are in back. And I know you know that, but I'm just trying to make this point. So, if we go in back, right? If we go in back, essentially, the medial ones, the semimembranosus and semitendinosus, grab onto the tibia on the medial side. One grabs on the tibia on the medial side and back of this condyle. The other one goes into the pes anserinus, but they both grab roughly right here, roughly on the medial side of the tibia. The biceps femoris like to come down here and grab on to the fibula and the tibia because they're lateral. Does that make sense? That's just a simple way to look at it without getting, by the way, your book gets really nitpicky about where it grabs behind here and all that kind of stuff. But really you've got the semimembranosus and semitendinosus grabbing here on the tibia, the biceps femoris, long head and short head grabbing the tibia and the fibula on this side.
So tibia and fibula?
Yeah, and actually I should know the exact one and I don't off the top of my head. Hold on, I have to actually look it up in the book to be very honest with you. That's enough information for me to do a massage, if that makes sense. And so
Right.
sometimes I forget the exact, although I'm the one in the class that should know, I completely admit. And now we have it on tape that I don't know. Let's see. Here are the hamstrings. Bear with me. Okay. So, there they are. Lovely, lovely. Why? I feel like I'm missing a page from my book. Oh. It's the biceps femoris I want to see. Biceps femoris. Insertion, head of the fibula, that's what I said. Yeah, Yeah, I accidentally nailed that better than I expected in some ways. So, the biceps femoris, which we know is on the lateral side, right, inserts into the fibula, which we know is on the lateral side. I thought one was on the tibia, kind of on the lateral, but no, they both both heads insert into that fibula. And then the semimembranosus and semitendinosus both go into essentially the medial side of the tibia because they're on that side.
But the tendinosis goes into the pes anserinus.
Yeah, so if we want to get nitpicky, let me show you the difference. I don't mean you're being nitpicky, I just meant like if we want to get really. So the difference is on the medial side over here, the semimembranosus goes into the medial posterior aspect of the condyle of the tibia. So you pick they call this the proximal condyle, this end of the tibia, the posterior side, the back side of it on the medial side. Whereas the semitendinosus actually hooks to the medial side, down here right below that condyle. So we're talking about a difference between here, where this thumb is, and here, where this finger is. But they're
So
both.
the semimembranosus goes into the medial side of the posterior condyle.
Yeah.
Okay.
And the semitendinosus goes into the pes anserinus, which is down here on the medial proximal shaft of the tibia. And I appreciate you caring and challenging me too, actually, to kind of define that better. Now, I have a hard time feeling that subtle difference when I'm massaging because there's a lot of stuff around the knee too. So, but yeah, good, excellent. Okay, wow, Ms. Hanson, those are good questions. So, Ms. Hanson, you can help us recap. Sorry, but what's the muscle group found in the posterior femoral compartment?
The hamstring.
Thank you. How many hamstrings are there?
3.
Yes.
4 heads.
With 4 heads, thank you.
Yes.
Which 2 hamstrings or 2 heads are found on the lateral side?
The bicep femoris.
Yeah, bicep femoris, long head and short head, right?
Yes.
Okay. Which 2 heads insert essentially into the head of the fibula?
The bicep femoris.
Yes, long head and short head.
At both of them, yes.
Yes. Which 2 heads insert into the medial-ish portion of the tibia?
The semitendinosus and the membranosus.
Good. Since we're getting really precise, which medial head inserts into the pes anserinus, which is actually on the medial proximal shaft of the tibia?
The semitendinosus.
Yes. Which head inserts into the posterior medial condyle of the tibia?
The semimembranosus.
Beautifully done. Which heads originate on the ischial tuberosity?
All of them but the short head of the bicep femoris.
Yes. Beautiful. Beautiful, beautiful, beautiful. Which heads create an extension of the hip?
All but the short head of the bicep femoris.
Excellent. Which heads create a flexion of the knee?
All of them.
Yes. Which heads can be considered part of the back fascial line?
Is that all of them?
All of them except for the short head.
Okay.
It doesn't matter, by the way. You're not going to go rubbing up the back of the leg and be like, I'm not touching the short head, which happens to be on the long head anyway, that I'm accidentally touching anyway because I know it's not part of the back fascial line. But the reason they're part of the back fascial line is they connect the gastrocnemius all the way up to the hips. And that's 3 of the 4 heads. Back, and we care about back fascial lines. Like, we care about front fascial lines too. We just haven't even really gotten to those yet. And side ones, which are really interesting too. Yes, Miss. Thank you, by the way, Miss Hanson. That was beautifully done. Difficultly worked through. Really good job. Yes. Miss Monreal, we meet again. You had your hand up, Miss Monreal.
I'm sorry, I was talking, but I unclicked the hand instead of the mic.
Oh, good.
Would there ever be like a situation where you would just be addressing the short head of the bicep femoris, but not necessarily the long head? Like, what would be? Do you get what I'm asking?
I get what you're asking. That never ever happens ever, no matter what. There's never a situation where that ever happens. No. Actually, no, I'm teasing because I don't have a good answer. Yeah. So I don't know of a situation where I'd be addressing the short head and not the other heads, but I can understand caring more about the ones that cross over the knee as opposed to the ones that cross over the hip.
Well, so not necessarily not addressing it, but like, what would a problem be that you would go, oh, you know what, like the short head inserts into the fibula, so maybe it's causing this. Like,
Yeah, I'll give you an example. I'll give you an example of why I might care about specific heads. And Miss Petrie, this is not an attempt to make another joke, but it is kind of a joke too. If I saw a knee that I thought was trying to laterally flex, and what I mean by that is a knee where it looks like it's tweaking out to the side a little bit, so the knee's breaking medially, but it's trying to laterally flex, right? That might tell me that the hamstrings on the lateral side are too tight, and I would care about both the short head and the long head of the biceps femoris at that point, because I think it might be pulling the knee out to that, making the knee buckle in by being tight on the lateral side. So I know that's hard to imagine, but if the knee's tight on the lateral side, it buckles in. If it's tight on the medial side, it buckles out. It's collapsing, right? And so I might care about one hamstring set more than the other if I thought the knee was buckling one way or the other. And I would work the opposite side. If it's buckling out, I think it's shortening over here. If it's buckling that way, I think it's shortening over here. But so that is a scenario. It's not that I would care about just the short head, but the short head and the long head of just the biceps femoris or the semimembranosus and semitendinosus really might be important to me because of knee alignment. That's why I'm getting so nitpicky about them, if that helps.
Okay, I mean, kinda. It was just a random question.
No, it's a really, this is what I long for, is to get to this place in your guys' education where it's not about us being right anymore, right? It's about us having a real discussion about, like, I guarantee you're going to get clients that I've never had before, with problems I've never experienced before or never solved before. And I want you to be thinking therapists. You're already way ahead of the other therapist comes in the room. They're like, I don't really know my anatomy and I really don't know what to do. I'll rub it. It hurts. I'll rub it. Honestly, that's the game plan. I think Miss Petrie will agree with me. That's the game plan for most therapists when they walk in the room. They've got a set pattern they do. They don't even know why they do it anymore. They do the same set pattern every time. They'll spend a little extra time on a spot you say that you have problems with, so you think they spent time on it, but they don't know what they're doing, and they just rub. And they're pretty good, by the way. It's still a pretty good massage. But it's not a calculated thinking therapist who goes, oh, if I position you a little bit different this way, I might be able to get in this spot over here. Maybe it's this shortened muscle over here. I know exactly what I'm feeling for. Those people are head and shoulders above the rest. And
I
rare.
spent 10 years just being a rubber. 10 years.
That's,
That's all they did. I'm like, I don't really know what I'm doing.
that's very kind.
I made 10 years of a career out of it.
And by the way, and this is not me trying to,
I had like returning clientele.
Yeah. yeah. Now, by the way, what did Miss Petrie make up for in her lack of anatomy? She did two things very effective. She's a very strong massage therapist, so she gave really strong, solid, thorough massages, and people have a hard time finding those. And she's a sweetheart. I didn't mean to flip everybody off. And she's a sweetheart. So who doesn't want to come to the nice, sweet massage therapist who rubs the snot out of you? I do. They're not asking her anatomy questions. But now she's going to take all that and throw anatomy on top of it, and she'll be unstoppable. Yeah. Power, kindness, and anatomy. Put those three together. Yeah. Boom. Heck yeah. That's what I'm talking about. Okay.